can have a physical exam, which can be normal or it can be a palpable mass. So we can see if it's going to be normal. Essentially, like if it's a palpable mass, we're immediately going for biopsy, age-based biopsy and imaging. As I have mentioned, like in my previous video, that if we have any sort of mass, we usually go for imaging. If it's breast, if it's like, for example, we have bilateral breast mass, then we go for imaging. If it's unilateral breast mass and we have pain over there, then we're going to go for, of course, we're going to go for imaging. Now we're going to go for biopsy over here. So it really depends on the if it's bilateral, unilateral. Unilateral means more chance of being cancer. I have a couple of questions over here. 46-year-old female. She comes with a left crusted left crusted stained nipple discharge. What's the next best step? So guys, over here, the next best step is just going to be to do ultrasound and mammography. So mammography plus ultrasound. And what I had selected was follow up in 3 months. Papillomas are benign and may have ductal carcinoma in situ. Invasive ductal carcinoma in situ and other associated areas of atypia with lesions. Therefore, patients with pathological nipple discharge require further evaluation, age-based imaging. So we can see over here, there's a 32-year-old female who's gravida 2/2 with nipple discharge with no palpable breast, with no palpable mass, nipple abnormalities and brownish discharge. What is the next best step? So again, over here, guys, we want to go for imaging. We want to do ultrasound. We want to do mammography. But over here, she's a bit young, so just do ultrasound. We have to also look at the TSH and the prolactin FSH over here. So guys, now if it's going to be no palpable mass, we're thinking this is going to be normal. We can think about it if it's going to be bilateral or unilateral. If it's bilateral, we're thinking about some sort of prolactinoma, okay? So we're thinking about some multiductal bilateral expressed only with manipulation. We can do galactorrhea and routine mammography is above 40. Guys, if it's going to be pathological, it's going to be unilateral, bloody, spontaneous, and age-based imaging, okay? So if there's any possible duct excision for symptom relief, or we can do a percutaneous biopsy. Now, if you have a discharge, okay, MRI can also help, guys. But what if you have a discharge? What can really help us over here? So if it's going to be less than 30, right? So we want to go for ultrasound and mammo. If it's above 30 or above 40, then we go mammo plus ultrasound, okay? Then let's come over here into what can the discharge be? Discharge can be yellow, can be milk, yellow, milk, brown, gray or green, okay? And then we can see over here lactation, okay? So we can see lactation, nipple pain, worse and persists with feedings, is commonly due to nipple injury caused by poor infant positioning and improper latch-on technique. Examination, patients can have open linear areolar abrasions, nipple appearing discharge. We can see where bruising, blistering may also be present. We can see breast engorgement can also be a bilateral. Diffusely tender engorged breast can also develop. Nipple pain, which limits the breastfeeding over here. Alright, so I'll just hide this over here because I don't want to get any problems over here. So we can see over here engorgement, okay? So if it's going to be bilateral, okay, bilateral, then we're thinking about symmetric fullness. We can think also nipple injury, okay? Nipple injury, so any bruising, cracking, blistering, and poor latch. We can see plugged duct, so that can be focal tenderness. Galactocele, very interesting, guys. That's after breastfeeding. Is me subareolar and mobile, non-tender mass, no fever. Mastitis is going to be here, tender erythema, fever, and abscess can be here. Symptoms of mastitis and fluctuant mass. Galactocele will be painful, painless. We can see breast engorgement usually going to be up to 3 days when colostrum is replaced by feeding. Guys, I have a lot of questions over here for you guys. So let's just say that there's going to be there's going to be 23-year-old female, gravida on para 2, severe breast pain in the left breast over the past 3 days, edematous in the lateral aspect of the left breast. This is galactocele, okay? What's the next best step, guys? It's going to be apply heat, okay? Apply heat to the area. Wrong answer over here, needle aspiration and culture. Maybe people who have a galactocele who fail to conservative therapy, okay? The next thing over here, 29-year-old female, gravida on para 1, and tender lump in the left breast. What's the next best step? Finding aspiration, we don't go for the doxycycline, okay? Now, free 137 also had this over here. There's a person who had mastitis, allergic to sulfur drugs, cephalexins fail, or we go for vancomycin. So we can certainly give vancomycin for the breast. You can see we have 42 left breast mass, 3.5 centimeter mass, right upper quadrant. Mass shows a brown fluid. So what's the diagnosis of fibrocystic changes? So we can see the premenopausal blue domed recurrent breast mass, pain and discomfort. Okay, galactocele, the painless breast lump, typically following cessation or lactation. So galacto means milk, and cele means any sort of cyst or any cystic that develops over here. So guys, I want to recap over here nipple discharge. Okay, so nipple discharge can be pathological or physiological. If we're thinking some sort of pathology, some sort of malignancies, we can just go directly into biopsy. Okay, so if we have any mass over here, we just go directly in biopsy. Then we can divide into physiological or pathological. Pathology means one side unilateral, and physiology means bilateral, which we can work out for galactorrhea, prolactinoma, and we can do a mammogram if she's above 40. If it's unilateral, okay, we have to look over there based upon her age. Okay, so she's less than 40, go for ultrasound plus mammography. Above 40, go for mammography plus ultrasound. And if it's abnormal, just go do some biopsy. Okay, any sort of abnormality, just we're going to biopsy. Guys, lactation over here, lactation is going to be worse between feeding, and there's going to be common nipple injury caused by poor infant position and improper latch on techniques. We can see over here the linear areolar abrasions with bloody appearing nipple discharge. We can see over here bruising, cracking, and blistering. May also be present. We can see breast engorgement, and we can see bilateral and the diffusely tender engorged breast. Okay, so what's going to be the different types? So we can have nipple injury, stuff like that. Galactocele if no fever, we think about abscess or mastitis. So we can see engorgement, nipple injury, plugged duct, galactocele over here. And guys, we want to see that you just give some NSAIDs. Remember that it can be, you have to give put heat. We can give aspiration. We can give vancomycin sometimes if cephalexin is going to be also there. And then we can see that, and if it's left quadrant, a mass, it can be fibrocystic. Okay, fibrocystic can be unilateral, which can also be there. All right.